What do we know about the innervation of the Meibomian gland? What regulates lipid secretion by these glands? Can you gentlemen input for us?
Well, most of what I know about the neural regulation is I've learned from Dr. Dart, and she gave a great talk this morning. Certainly, we know that those glands depend a lot on on blinking for secretion, and I think recent studies have shown that patients that stare a lot or view video display terminals don't have good Meibomian gland secretion, and so they may become stagnated, and then secondary changes can develop. As I showed in that video of my patient, when you have an adverse environment on the lid margin, that can also affect the Meibomian gland orifices. So in some patients, their tears can actually be an enemy and induce squamous metaplasia of the Meibomian orifices, which eventually will block other secretion. And obviously, we recognize that the Meibomian glands are androgen-sensitive glands, and hormones play a large role.
I just bring us back to the fact that the Meibomian glands are modified sebaceous glands. Not that modified, by the way. So the monstrous literature in sebaceous glands can't be ignored in trying to understand both the functionality and the innervation of the Meibomian glands. And it is the autonomic nervous system, and it's certainly, we do know that if we extrapolate from contact lens wear, particularly historic hard contact lens wear, one of the things that happen in what was called the adaptation process, those of you who may remember still with RGPs, that the first couple of weeks you wear the lens are not very comfortable. After a while you adapt to it and you're fine. Part of it is developing a comfort level with oxygenation, your decay. The other part is that if you follow with Cochet-Bonnet the sensation over the lower lid in the Meibomian gland, I say, Kathy, you remember that, the sensation does decrease a little bit. And we do know with chronic contact lens wear, there is a decrease in Meibomian gland function that's sort of related in lockstep with that. So certainly sensation is necessary. The interesting thing about the Meibomian gland, if you realize its function, is how does this stuff get out of it? You have real lens muscle that wanders through it, but you need a real good squeeze or probably a knuckle rub. And I see you rubbing your eye. What you were just doing was exercising your right to increase your Meibomian gland secretions onto the tear film. And so that function is certainly highly innervated. How it controls the ratio of all the lipids is a fascinating question, and I don't know that we know that.
Thank you, gentlemen.